And the fact that he was home for 5 weeks this summer, while the most important legislation probably in decades is being debated and didn't hold a single town hall forum, that to me reveals that he's gone to Washington.
You mentioned
TOO.
you mentioned health savings accounts and tort reform and selling insurance across state lines. Are those kinds of steps going to be are they going to be sufficient to make sure that everyone has health insurance coverage?
There's certainly a step in the right direction. If we can shrink the 5% to 4% to 3% to 2% incrementally, we can, I think we can make some real progress. I think there's some other things. We have to deal with portability issues. We have to deal with coverage for pre-existing conditions. It's just blatantly unfair in this society of ours. And there are people in my own party and friends of mine who will argue with me over that. And they'll use the analogies of, do you go buy fire insurance? Do you get fire insurance after your house is burned down? We are still the richest country in the world. We do have the highest quality healthcare system in the world. We do have the best access. We do have the latest and greatest in technology and pharmaceuticals, and all that costs money. But we ought to be able to pass some decent regulation that requires or allows people to take their insurance with them when they move, that allows small businesses to pool their resources and lower the costs, and we ought to be able to meet the demands of pre-existing conditions.